So this is a question we get a lot is it hereditary or are there genetics for it? So as part of our fundamental panel, for anyone doing this, we run the most important genetic marker is called APOE. Now APOE, you can have APOE E2, APOE E3, or APOE E4. We're going to talk mainly about 3 and 4. 4 is the big risk.
So you get one from mom, one from dad, right? So if you get an APOE E4 from mom and an APOE E4 from dad and you have a 4-4 component, that's a very high risk factor that you would want to be a lot more serious about it, right? If you had that versus someone that didn't.
So if you have 2 copies of the APOE E4, you'll often get Alzheimer's in hereditary fashion. It'll often pop up. You'll start to have symptoms in the 40s, 50s of just being forgetful and the brain not clicking with new information, and you can get diagnosed Alzheimer's fairly young. If you have 1 copy of 4 and 1 copy of 3, we'll often get it, but it'll be a decade later. It'll be 50s, 60s, not 40s, but it'll be a decade later. If you have 2 copies of 3, oftentimes, even if it's in your family, it doesn't pop up till it's in the 80s or 90s even.
In a traditional medical model, we don't test these things like super early, typically, and especially like the APOE test is super easy and relatively inexpensive, where you can get it done through a specialty lab, and they can tell you exactly what your genetic factor is on that.
If this is at all a concern, let's get you APOE tested. And if you're at a certain thing, depending on how many copies of 4 you really have, we can do more proactivity if you're at a more genetic risk factor for it.